Well, hello everyone and welcome. Thank you very much for joining us today. My name is Brenda Schuster. I'm a pharmacist at the Family Medicine Unit here in Regina. And joining me on the webinar today is Camille Gagnon, who's a pharmacist as well and is the Assistant Director with the Canadian Deprescribing Network. And both Camille and I are part of a planning committee that's been working hard on the Making Meds Safer for Older Adults conference, the 2020 Saskatchewan Stakeholder Workshop. If you dialed in today, you likely were registered for that event that we unfortunately had to reschedule, but you're probably here because you have a strong desire to see change. Change happen around medication safety for older adults in Saskatchewan. You may be a community organizer, you may be a healthcare professional, you may be a policy leader in the province. Before we get started in the session today, we just wanted to take a minute to acknowledge how over the past few weeks a lot has changed very, very quickly. And really in a world working to mobilize to slow the spread of COVID-19, you know, we all have preoccupations that are likely taking over our thoughts and our time. And this is true for all of us. We hope everyone is staying safe and staying well, and we wanted to just take a minute to thank all our healthcare workers on the front line and all our essential service workers. We were really thinking of you and so grateful for the work that you are doing. It's interesting to think, you know, in a time of a pandemic, medication appropriateness remains more relevant than ever. The key principles supporting the appropriate use of medications, you know, preventing harmful effects, ensuring the wise use of human, technological, and financial resources, we can help ensure our health system withstands the incredible stress that a situation like COVID-19 is exerting on it. When we use medications appropriately, we can help reduce the strain on patients and on the healthcare workers. This is part of why we decided to hold this short session for you today. We also wanted to have the opportunity to meet with those that are keen to attend in order to share some key information about the visions and goals for the workshop and to help prepare you for the future meeting. You know, please note the date has yet to be selected, and we're certainly going to be sending that information via email to you as soon as possible. And also, you know, the key point is this webinar will not replace the event. But as the title suggests, you know, it's meant to get our wheels in motion, get us collectively thinking about ways we can collaborate in the future to reduce harms for risky or inappropriate medication use in the province. Throughout the webinar, we invite you to share your questions by using the Zoom chat box function at the bottom toolbar. At any time, please feel free to either connect with us directly as the presenters or to make your comments public. And certainly we'll do our best to address your questions as we go. And if for some reason we can't get to your question by the end of the webinar, we'll be sure to follow up with you directly. I also wanted to mention the webinar will be recorded and it will be available on the Canadian Deprescribing Network YouTube channel. In addition, for those that are interested, we will make our PowerPoint slides available to you after the presentation based on request basis. So moving on, as mentioned initially, you may be representing a community organization, you might be a healthcare professional or with a healthcare professional organization or department, or you might be coming to the webinar with the policy lens that you wear in the work that you do. Today our goal is to highlight the different viewpoints each of us bring to the table when we look at appropriate medication use, as well as to make a case for why we need to tackle this issue in collaboration together rather than in our distinct silos. More specifically, we will introduce to you the Canadian Deprescribing Network's goals and our projects, and then point you towards some tools and resources that you can use to support medication safety in your work now, as well as get you thinking of ideas for new initiatives in the province. And then when we do hold events, our whole idea and thinking behind all of this is that this webinar today will actually make us more successful in sparking some great work in the future in Saskatchewan. For our disclosures, neither Camille nor myself have any relationships, commercial interest with either anything related or unrelated to this presentation today. The Canadian Deprescribing Network is funded by a grant from the Canadian Institute for Health Research. So let's get started. I'll start by talking about why all the fuss about risky medications. Well, as we all know, medications can help us in many different ways. And certainly as a pharmacist, you know, I've seen how medications have helped patients every day. It's helped make them live longer. It's improved their quality of life by maybe improving their symptoms or preventing a heart attack or a stroke. However, we know with every medication that we take or that we prescribe, along with these potential benefits of the medication, we always know that there is potential for harm. And medications that are known to potentially cause more harm than good for older adults are known in what we refer to as risky medications or potentially inappropriate medications. Potentially inappropriate medications are very common. Nearly 2 million Canadian seniors regularly take at least one potentially inappropriate medication. What we know in Saskatchewan, 46% of older adults have a claim in their file for a medication recognized as being potentially inappropriate. And every day seniors are harmed by these medications that might be inappropriate for them. And we know that seniors are actually hospitalized at a rate 5 times over than a person less than 65 as far as their medication causing them to go to the hospital. So let's go on. What about the impacts of patients, the impact of all this on patients and on healthcare resources? When we talk about the importance of appropriate medication use of resources through the wise use of medication, it's because we know the harmful effects of medications can cause patients pain and sorrow. And some examples here are falls and fractures. These can lead to hospitalizations and even in the long term, potentially to premature loss of independence. And the cost of treating these harmful consequences is high. 1.4 billion tax dollars are spent every year treating health problems in older adults caused by potentially inappropriate medications. So when we think about it, with limited resources, this means there are fewer funds available to support safer care for patients. The workshop will be an opportunity to get everyone's heads together to figure out how we can address this problem collectively. So I'd like to turn it over to Cami now.
Yeah, thank you, Brenda, for this strong start and also for sketching out the portrait really of the Canadian landscape in terms of medication use and concerns really that we do have. So I guess our point number 2 kind of fits in naturally now for me to introduce the Canadian Deprescribing Network. So that's our point number 2 here today. What is the Canadian Deprescribing Network? Now, to make things clear, I'd say the easiest way would be to dissect it into 2 parts. And I'll start with who we are. So really simply said, we're a mix of people, a mix of individuals from different spheres of activity, including patient advocates, community organization leaders, healthcare provider champions, policymakers. And it's important to remember that as these individuals we have in our network are very active and engaged, a lot of them wear multiple hats. So they don't fall in just one of these categories. We're lucky enough to have a lot of those. And our members come from everywhere in the country, from rural, urban areas. All of us members work together towards 2 common goals. So what brought all of these stakeholders together in 2015 was those common concerns that Brenda kind of drawn out to start off. And this figure just shows exactly how everything was organized and revolves around patients, their caregivers, and the public. So the first goal really that was identified as an organization was to eliminate the use of potentially inappropriate medications for older adults. So as described by Brenda, we know that these medications can lead to a variety of harmful consequences for the patients, their families, and unfortunately, they're very common. So we've been working together to reduce exposition and use of these medications. And to do so, we need to make sure that the medications are continued when needed, but stopped when appropriate. And that's where I'll come in with the definition of deprescribing in our name, because it's a fairly new word and not everyone knows this word. Deprescribing, the definition, means reducing or stopping medications that may not be beneficial or that may be causing harm. The goal of deprescribing really is to maintain or improve quality of life. Now, embedded in the concept of an inappropriate medication is that we also have to consider there is a safer alternative available out there. That alternative can be another medication or a non-pharmacological option or non-drug. So to reduce the use of medication that could be causing more harm than benefit, the second goal of the Canadian Deprescribing Network is to increase access to these safer alternatives. Some specific examples I can give you today of evidence-based non-drug treatments for specific conditions can be psychotherapy for treatment of anxiety or insomnia, or physiotherapy for chronic pain. We know that a lot of Canadians today do not have access to such therapies, and that can be problematic if given the option of treatment, they cannot access these. So as mentioned initially, our members are located everywhere in the country, and to ensure planning and coordination of these activities, our small team is located in Montreal, specifically in the research center affiliated to the Montreal Geriatrics Institute. So that kind of gives you an idea of who CaDeN is. And for the next key things you need to know about CaDeN and appropriate medication use, we'll dive into really what we've been doing, what our activities are. And as I've mentioned, we've been doing this since 2015. This is when we started the organization with those two big overarching goals in mind. We have with time accumulated a specific experience working with the different stakeholder groups. And we've learned a lot. I can speak for myself, but I can speak for the group as well. We've learned immensely along the way. So here are key learnings that we have accumulated. Firstly, working with the public. So by sharing this information with members of the public, including older adults and their families, what we aim to do is to increase awareness and create change in behavior, really. So we want to spark conversations between patients and health providers around the issue of safe medication use. Now, unfortunately, we know that a lot of seniors, a lot of the patients that take the medications are not necessarily aware that their medication could be causing them harm, or is actually maybe right now, as we are speaking, impacting them negatively, or in the future could be causing them harm. So this information needs to be shared more broadly. But there is a good side to this story, because as we've started partnering with a growing number of organizations that represent or provide services to older adults, the response has been unanimously positive. So members of these organizations have an appetite for this type of information on medication safety and just love to share it with the people that they are in their community. So we all know that in the older adult population specifically, the other thing that we've learned is that, well, we could have guessed, not everyone has access to the internet. And so we had to be creative. We had to find other ways to reach people effectively. So this is why the collaborative approach we've held with seniors organization is key, because they know what their members want in terms of how to get this information and how to make this the most relevant as possible for them. And so we've been putting a lot of efforts to reach seniors everywhere. So our awareness campaign, major slogan really is, do I still need this medication? So here are just a few statistics from our 2019 annual report. You have that on the slide. And we've been reaching older adults that live at home or older adults that live in nursing homes, their caregivers. We've been translating some of the tools to a number of different languages. We've worked with caregiver organizations to share this information as well. And this sharing of information, as you can see with the pictures there, has been done either through in-person events or as well through sharing of written information or online as well. An example was Brenda Schuster, my co-presenter, who was in past November at the annual meeting of the Saskatchewan Association of Rural Municipalities Convention. So just another example of how this has been happening everywhere. So the ultimate goal of this campaign really is to have patients engage with health providers and ensure a continuous reassessment of their medication over time. But to ensure that patients have a positive experience when they engage with their health provider to talk about their medication, we then have to make sure that the health providers feel that this is on their radar, medication safety. So they recognize that this is an important issue. They have to know where to find the best evidence and best practices available to guide their decisions. And they also have to know where to find the tools that can help them do so. So this is why, in parallel to our work with the public, we've been doing a lot of work with health providers and putting a spotlight on safe medication use. So yet again, we've learned a lot working with health providers who also respond very positively to this type of information. Not surprising, because as health providers, they've all seen how too many medications, or just not the right ones, can have a negative impact on their patient's health. And they've seen how taking one medication away in some context brought the patient back to who they really were. And the caregivers or the family members just said, wow, this is day and night. So a lot of them have told us that they want to start deprescribing. This is something that's important to them, but they may not know where to start or where to turn to access evidence-based tools. So we know that this is something that we've been putting forth really, so bringing the tools forward for them to feel equipped. So we've been working with prescribers, but not only. We know that everyone on the healthcare team needs to be involved to make sure that patients are not harmed by their medication. It has to be on everyone's mind. So we've been partnering with professional bodies representing various health professions like nursing, pharmacy, physiotherapy, psychology, etc. So we know as well that a lot of professions more and more are gaining prescribing rights as well. So the involving role of health providers in Canada is changing more than ever. So we need to be moving with that as well. So knowledge transfer has been front and center for us. And we've been doing a lot of this work, yes, with the public, but with health providers. And we've been sharing tools such as, you have an example here of a deprescribing algorithm to guide decisions based on evidence. And we've also been providing training either through virtual or in-person sessions for health providers through continuing education, as well as making sure this type of training, this type of information is embedded in the curricula of all health providers. So the last group I'll be discussing today and that we have been working with are policymakers coming from different provinces. Once again, when they look at the impact of medication harm on the members in their community and the associated burden that Brenda gave us a few stats about, making medication appropriateness a reality is more than ever a relevant goal for policymakers. And thus, policymakers have been active. They've responded quite positively to the evidence available from Canada, but also abroad. There are multiple examples from different countries that we can be inspired, that can inspire us. So policymakers are keen on considering different strategies that have worked and then adapting them, firstly assessing them and considering if they could be adapted and implemented in their jurisdiction. Today, I'll be giving two examples of policy projects that we've had the chance to lead in different provinces in Canada to develop and implement large-scale medication safety projects. So our objective, as I said, is to address the most pressing local issues identified by the policymakers and identify and recommend strategies that could work with them, for them. So a first example of a large-scale initiative is one that was developed in Newfoundland and Labrador. It is called the Safer Meds NL project. This project is a partnership between CaDeN, the government of Newfoundland and Labrador, and Memorial University. So the goal of the project is to reduce the use of potentially inappropriate medications in the province. And the project design is based on something called collective impact. The name says it all. You have everyone involved. So it combines a provincial public awareness campaign. It involves like ads and events to target the public, active engagement from healthcare providers like nurses, doctors, pharmacists, to whom we provide tools and information to engage in conversations with their patients about the potential deprescribing of such medications. And we're tracking our stats right now because the project was launched in 2019. So we're looking at the impact of this large-scale initiative in Newfoundland and Labrador on the use of specific medications. You have an example of a poster here that was launched and distributed specifically on proton pump inhibitors, so medications used to treat namely gastric reflux, acid reflux disease. So we're hopeful this initiative will have a long-standing impact in the province. The second example of a project I will briefly cover is an intervention targeting opioids in partnership with the government of Manitoba. As Canada was in the midst of the opioids crisis, policymakers in the province were interested in leveraging public education to help reduce the use of these medications for treatment of chronic non-cancer pain, as we know they carry a high risk of harm. So patients were identified and were sent an educational brochure at home, pending that they met certain specific criteria. So the policy was yet again designed based on evidence from previous randomized controlled trials. So the result of this large-scale intervention the results are expected in 2020. So these are just a few examples and may have you start thinking about, wow, there's a lot that can be done and there is a lot that has been done in the country until now. So if you were intending on attending the workshop, we know that you can help us solve this issue in Saskatchewan. Maybe this is all new information to you. Maybe you already have a foot in this scene and you're quite active, but regardless of your level of engagement today to now, we are ready to work with you to change things. So the next slide gives you just an idea of different members in our organization that are located in the different provinces and what they've been up to in their community, their university, their clinic, name it. So I invite you to check out our 2019 annual report to find out more about the work of these exceptional individuals. And you may be curious to read more about, yes, our members' work, but also want to find out more about the tools that are available to support the safe use of medications. So this could be an excellent way to start preparing your participation at the future workshop. So these tools are available at the URL you see there on our website for you to check out. And now I'll be handing it over to Brenda to guide us through specifically really what to expect once we have selected the new date for our workshop.
Sure. So the medication safety workshop, I guess the key thing to tell you is it's going to be really action driven. And it's reflected in the goals of the workshop. And then the next few slides, I'm going to go for some specific examples highlighting about the workshop agenda and how there'll be lots of opportunities for you to learn, network, and brainstorm. And really our goal with the workshop is that you will leave the event feeling equipped, connected, and really inspired to make an impact in your community or organization. So for the first example of how we'll be asking for everyone's input during the workshop, our leading physicians, Dr. Jenny Bazaran, a geriatrician many would know from Saskatoon, and a family physician here in Regina that I work with, Dr. Solveig Nielsen, will be presenting actually real life patient stories from their practice caring for older adults. Then what gets interesting, we'll be asking you as participants to share your perspective on those patient care cases and identify levers to help reduce medication harms, things you could think about that could be done as an individual or from your organizational perspective or the hat that you wear to the meeting. Next, after the Deprescribing Fair in the morning, we'll be giving participants the opportunity to discover key medication safety and deprescribing programs that are actually available here in our province. And the idea is that they can share and bring them back, these ideas and these programs back to their work and to their communities to increase awareness of what's right here in our province. Saskatchewan is known for setting great examples in the country, and these sessions will be an excellent opportunity to really, shine a spotlight on what's going on in our province with great local initiatives. And the examples that will be shared will be both from the community perspective, the healthcare professional and healthcare policy perspective. Next, in the afternoon, this is where things really all come together and we really get interactive. We'll have our key leaders from the Canadian Deprescribing Network, namely Dr. Jim Silvas, who's a geriatrician from Alberta and is also the co-director of the Canadian Deprescribing Network. And then also from CaDeN, Justin Turner, who's a senior advisor on the science strategy. And he'll lead, the two of them will lead innovative sessions, which will have us work on developing and identifying concrete next steps to improve medication safety for older adults in Saskatchewan. In addition, Justin will be presenting groundbreaking medication safety projects from other Canadian provinces, things that have been successful at bringing people together, the different stakeholder groups, the public, healthcare organizations, healthcare professionals, and people working in health policy. So to date, I think it's really important to note, CaDeN has had similar multi-stakeholder workshops in 3 different Canadian regions, one in British Columbia, one in Manitoba, and a third for the 3 maritime provinces. And this is just a picture showing what the stakeholder workshops have looked like in the other provinces. And although CaDeN hasn't had a complete analysis done at this point as far as the impact of these meetings, we've really been struck by the creative initiatives and the new partnerships that have come out of these stakeholder meetings. And really, it's been very positive impact. Each event has taken its own shape. They look a little bit different from province to province. And our planning committees worked really hard to develop a stakeholder workshop that would be good for people in Saskatchewan, for our community. We're going to have a little bit of a unique workshop. It's going to be special in many different ways. And really our planning committee knows that exciting things are going to happen at this Regina Stakeholder Workshop when the date is set. So, so this is where next we would ask you really for your input in the webinar. We basically would like you to share your thoughts either in the chat box at the bottom with the whole group or privately. Or if you need to think about it a bit, we welcome you to send us an email after the fact and let us know what your main priority is when it comes to appropriate medication use in Saskatchewan. This will help us make the future workshop even better. So as you're gathering your input, I'll just finish by saying, let's spark change in Saskatchewan. We're looking forward to collaborating with you in the future. To learn more about CaDeN's work, visit the deprescribingnetwork.ca website. Here you can go into the report section of the website and you can find the latest annual report that Cammie's referred to, and you can get more details on CaDeN's recent activities. Most importantly, be sure to be on the lookout for the announcement of the new workshop date. We want to make sure all stakeholder groups will be attending to ensure that our program, our stakeholder workshop, is a resounding success. So with that wraps up our presentation for today. Cammie, is there any questions?
I'm looking at the chat box. I invite participants to enter questions if they have any. I know I have one, and it's something that we've talked about before, Brenda. You attended our national workshop back in 2018, 2 years ago already. And we were wondering if you had any suggestions for people of things people could do if they're keen and want to get active on this now, between now and the eventual workshop date.
Yeah, no, for sure. It is something that's been on our mind as a planning committee, a little bit on the disappointed side that today didn't happen the way it was supposed to, but looking at it, every disappointment, there's always an opportunity. And certainly for anyone on the line that is a healthcare professional, whether you be a pharmacist, physician, nurse practitioner, nurse, etc., working in a long-term care facility, I really encourage you between now and then to actually go to that website and really click in and look at those resources that we're talking about. Get a sense of what is there. These are resources that I use on a weekly basis in my practice to assist patients Sometimes it's, on a busy day, it might be something I print out quickly to get the patient thinking about my concern with their, for example, medications that they use as sleep aids, and then it gets them going away thinking and reading, and then when they come back for the next visit, it opens up an opportunity for a good, open, honest discussion with the patient. So look at the tools that are there for you to use. Also, as healthcare professionals on the line, once you have a chance to check that out, share the resources with your colleagues, get people looking and seeing what's there, so that when they're doing patient care on the run, they can really engage these things at their fingertips to help them be efficient and effective in having these conversations and initiating these potentially dose reductions or deprescribing of medication. For those on the line that are maybe here more in a community perspective, a member of the community, look at the resources as well. Think about what information is there. Think about how you might connect with people in your community. Are you involved in a senior organization that maybe has a newsletter that you could promote the messages that CaDeN has? Are you planning an upcoming meeting that maybe we could be on your agenda? Is there an opportunity for us to link with you, to link with people in your community directly to engage older adults around this important information? I was also thinking, finally, for those that are on the line, I was thinking from the perspective of a policymaker and getting you to think about obviously what you do every day. What is our organization doing well? Where have we really been successful in trying to make medication use safe in the province? What's really worked? But then really to think about, what are the gaps or what are the opportunities for really to move forward? How might the resources from CaDeN assist you to implement a program, a policy, or to support some initiative that your organization is thinking maybe this is something that needs to be looked at here in Saskatchewan? What could be the next step for safe and effective use of medication in Saskatchewan? So I have lots of thoughts on that. I know that was a long-winded answer, but I really want people to start exploring, and then this is again what's going to make our workshop really effective and impactful.
Wow, Brenda, I mean, you have a lot for us to think about and excellent pointers on where to start. I think it can be a bit overwhelming, but all of the examples you gave us really just, no reason to not get our hands in and start. So I just want to thank everyone once again for being with us today. Please stay safe and stay healthy. We really look forward to connecting with you over the next few months. If you have more questions or you didn't get answer to some of the questions you had today, make sure to contact us through email. We will be sending the recording of this webinar out as well to all participants, and we invite you to share it with members of your community or people that may be interested by this topic. So thank you once again, everyone, and thank you, Brenda. It was great to have you here today.
Yeah, thanks everyone, and have a nice weekend. Thanks.